Hi, everyone. My name is Mary Elaine Petrucci, and today I'm so excited. We're having our third masterclass on lack of support for caregivers, family caregivers specifically. So what I would like to do is just share my screen. To thank everyone for being on today. If you have any questions, please put them in the chat. Love to answer any questions that you have as they come up in our presentation today. So thank you again for being here, and let's get started. So we're going to be talking about compassion in caregiving, tips to create a more supportive environment when you're caregiving for your family member, caring for someone in a hospital, in a hospice setting, a holistic practitioner who is providing care for a client over the internet. So let's get started. Let's talk a little bit about some statistics that are really critical for us to understand the lack of support that is starting now and will be getting to a crisis point in 8 years, and we will be discussing that in just a moment. By 2030, 72.8 million Americans, more than 1 in 5, will be 65 years old or older. In addition to that staggering statistic, is that will be 45% of the American workforce. And that will mean that there will be some really ill baby boomers, older baby boomers, who will possibly not have the care that they need. And that is one reason why I would like to advocate for caregivers, is because this will be a crisis unless we can provide tools and resources to caregivers so that they can be more effective in the care that they provide and that they will continue to provide in the years to come. There's the greatest growth among the old, who are typically most in need of help. And this is what I was referring to earlier. The number in that group, those in their 80s and above, will soar from 27% in 2012 to 37% in 2050. We'll be having a crisis here in the United States in 2030 when the 72.8 million Americans start to retire, and those old will not be provided the care that they need. There are 44 million unpaid elder caregivers in the United States, and 75% of them work other jobs. And this means that you could be a family caregiver and you're working full-time, possibly still raising children and caring for a parent or grandparent. There will be greater financial stress and challenges in balancing work and family. And of those who do work, only 53% say their employers know about their additional caregiving responsibilities. And this is another place that I would really like to advocate for, not only with legislators, but with corporations who need to be aware of the resources that will be needed for their employees who are providing care outside of their work hours. Close to 70% of working caregivers adjust their work schedules to accommodate caregiving responsibilities. So they may be taking paid leave time off, or retiring early, they're quitting, or they're turning down promotions, which really puts the family caregiver in a bind, because when they retire, that reduces their Social Security income. They are forced to set aside their own ambitions. Again, it significantly impacts their financial situations. Some caregivers think that they can be a caregiver for a year or two, and that situation increases to many more years and will affect their financial situation. Presenteeism may cost employers even more than absenteeism. And what that really is that the employee is at work, but they're not at their full potential because they are thinking of all the other caregiving activities that they will be providing outside of the work hours. The average working caregiver misses about 6.5 days per year. And that reduces a lot of the productivity that corporations really need to advance the company and become a leader in their respective industry. So losing out on an employee when they're not working really impacts the bottom line of both the employee and the employer. And over a lifetime, employees who leave the workforce to care for a parent or a family member lose close to $300,000 in wages and benefits, and that is very staggering. And the loss is even higher for women. So think about that for just a second, because it will definitely impact not only their present financial situation, but it will impact their retirement as well. Working caregivers who live paycheck to paycheck are often hit the hardest by the financial strain of out-of-pocket long-term care costs. And this is so important because it's critical for family caregivers to have a really heart-to-heart discussion with their family member, their parent or grandparent, and really look at all aspects of what they're doing in terms of their retirement, whether they have a will, a trust, all the financial, legal, and medical documents in place, and they have final arrangements made as well. All of this information, when it's not available, really impacts the bottom line of the working caregiver. And many lower income women of color caring for a parent or family member need daily hands-on assistance for tasks like bathing or dressing. While 41% of caregivers say they experienced no financial strain from caregiving, 18% say they endured a high financial strain because they lack the outside resources or the company's ability to give them extended family leave. And those between 18 and 49 years of age experienced the highest strain, likely due to reduced savings, higher debt, and trouble controlling their expenses. So what do all those statistics mean for aging boomers and family caregivers. Healthcare and social service systems have not adequately prepared for this big change in the demographic shift that will affect so many older adults and their caregivers, especially when in the next 8 years, we will have a staggering amount of baby boomers who will be retiring from the workforce. And that is 45% of our workforce, which means that there will be a really high degree of no caregivers for those old baby boomers. Today's caregivers are often marginalized. They're left out of treatment decisions, and they're untrained for complicated tasks. So for changing G-tube, changing wound coverings, it's very challenging because they're working alone with no support, no resources, and they are totally stressed out and burned out because of the challenge of caring for a family member. Yet they are assumed to be available for a broad range of duties, like taking your family member to a doctor's appointment, taking them out shopping, taking them for their annual exam, seeing specialists, seeing the dentist. There's a whole range of activities and duties that the caregiver is responsible for and not prepared to perform those tasks adequately. Caregivers comprise an invisible workforce that provides vital support to a growing number of individuals suffering from physical, psychological, and neurological complications, especially for those who have a mental disorder or a neurological condition such as Alzheimer's, Parkinson's, ALS. Usually unpaid caregivers tend to be family members who care for their relatives out of love or because they cannot afford to hire help. If this work were replaced with paid services to those family caregivers, it would cost an estimated $470 billion annually, and that is staggering. About the cost of being a family caregiver without support. So what do? Only 13% of caregivers say anyone has ever inquired about what they need. And how can you help others? And this is really important. Everyone who is a family caregiver or works with clients in holistic healthcare, such as nurses, doctors, or even people who find themselves caring for someone, always need occasional reminders that they are not alone. And that is why I have created the Caregiver Lifeline community, a membership site where caregivers can get the support from other caregivers in the community, from experts who have been on my conferences, and myself, as well as other resources on Medicare, Medicaid, and grief support, and other services that are critical when you're a family caregiver. Often caregivers may not realize the extent of their stress and burnout. because they're going 24/7 and not taking any time to self-charge themselves. Just listening without judgment provides caregivers with a valuable outlet to vent their frustrations, anger, guilt, and hopelessness. It doesn't take much to check in on a caregiver while treating patients. So take time. If you're a family caregiver, if someone else in the family could check in with you on a regular basis, have some way of getting to a senior center nearby, if at all possible. Find a group support system for caregivers, such as the Caregiver Lifeline community. If it's clear that the caregiver needs more help, connect them with a mental health clinician, because you really want to prevent that family member from being in burnout, where they are not making the best decisions for themselves or the person that they're caring for. Often caregivers just need help accessing the right resources and information. And again, that's what you can find in the Caregiver Lifeline community. I wanted it to be a place where caregivers could find the information that they need really quickly, so they didn't have to go online, which I know you don't have time to do, to find that information that you need accessed right away. If there is a particular concern or issue that is not covered in the community, Caregiver Lifeline community, I will be more than happy to discuss that with you and find the resources that you need. You can help others by helping them navigate insurance and the healthcare system, which can be daunting and vary in what they will or will not cover for caregiver support. You need to discuss with caregivers and offer them resources to help them gain the clarity that they need to be more present with the person that they're caring for and for the others that are around them. There are some national helps that you can access, and you can engage in the Family Caregivers Act for some support and assistance to improve coordination across government programs to assist caregivers and their recipients. The Credit for Caring Act is something else that you can look into. Again, the Family and Medical Insurance Act, Leave Act, is another piece of legislation currently in Congress, which seeks to create an insurance fund to provide workers with a portion of their wages for up to 12 weeks a year when they're seeking care for their own health needs or supporting a family member. There's also some technology help. Well-limited technology has provided benefits to about 53% of caregivers, although it generally depends on their age and their comfortability about using it. There are aids like Circle of, where a group of caregivers can put their names in for a particular person, and those inner core people can help each other in providing the care and the services that the client needs. Also, Care Trainer is also another device so that family caregivers can do really quick 90-second videos regarding the information of what the particular person needs in the living room, dining room, a bedroom, and bathroom. So there are resources available for you. There are some software that you can track the recipient's finances and personal health records. And only 17% of family caregivers or caregivers in general use apps, videos, or wearable devices to track a recipient's whereabouts and safety. Now I'd like to offer you 7 tips to create a more supportive environment for not only for yourself, your loved one, and the other people that you support in an healthcare environment, in a hospital, a hospice, home care environment, just anywhere where, even virtually as a holistic practitioner, helping others online. The first is mindfulness, where it's a state of mind that focuses on the present moment without judgment or distraction. It can help increase concentration and reduce mistakes, support better self-care, and reduce stress and anxiety in both caregivers and the recipients. Using mindfulness can allow you to better identify and manage levels of psychological stress. It's more likely or less likely for you to intervene with physical restraints and emergency medications with patients. And it also helps significantly reduce any aggressive behavior. Gratitude is another very helpful tool. Making an effort to recognize even the smallest positives in every day can help you keep things in perspective by writing down how grateful you are for anything that occurs while you're caregiving or just in your personal life in general. And I highly recommend that you use a gratitude journal where you can quickly jot down a few things you're grateful for. It's also a good release and a good reminder for later how grateful you are for providing care to your loved one, especially during challenging times. By getting the support that you need, you really start building resilience. Resilience is the ability to recover quickly from stressful situations. It can be strengthened through a mindset that keeps things in perspective. So mindfulness that we just discussed. You can use humor to diffuse difficult situations. You can focus on compassion and positivity and engage in meaningful activities and be in the present moment. For example, if you like to walk with the person that you're caring for. Or if they're not able to walk, have them put them in a wheelchair and walk around the neighborhood and just look at all of what nature has to provide out there. Just be present. And when you're present, you're building resiliency, you're working on mindset, and you're also working on gratitude. Another way to improve your outlook is positive psychology. Positive psychology is the scientific study of what makes life worth living. It was established in 1998 by Martin Seligman, PhD, and his program focuses on positive emotions, behaviors, and character strengths, which help mitigate the effects of burnout among healthcare providers and caregivers. In other words, put on your oxygen mask first before helping others. And be encouraged and empowered to ask for help and advocate not only for your needs, but the needs of the person that you're assisting. The fifth tip is don't suffer in silence. Ask your employer about benefits, such as backup care and resource and referral programs. Ask if there are workplace policies like flex time, so you can adjust your schedule and spend more time caring for your loved one if needed. Ask if the company has family medical leave policy so that you can take some extended time off to be more present and available for the person that you're caring for. Also note that companies with 50 or more employees are legally obligated to allow employees a protective leave of absence to care for children or aging parents. Typically, it's without pay. However, it may save your job and your sanity and burnout. The sixth tip is to follow the Boy Scout motto, be prepared. Learn about payer options, Medicare, Medicaid, long-term care insurance, and veterans benefits. Also ask your employer if they offer classes or information on elder care topics. You can also go to medicare.gov for information about long-term care and how to pay for it. Elder law attorneys can provide you with much needed information about estate planning. Familiarize yourself with the financial landscape ahead of time so that it results in less confusion and better outcomes, not only for you, but your loved one. Make sure that you have like all the legal, healthcare, and insurance information and final expenses in place before there's an emergency where you may or may not be able to help your loved one in the care that they receive. Again, have the talk about money. It's a very challenging topic to talk about with parents or someone that you care about. It could be a very thorny topic. However, it's so critical that you have this discussion. Viewing money as a private matter is ingrained in our American culture, particularly for the generation that came of age during World War II. If you have candid conversations about money with the person that you will or might have to care for in the future, now or in the future, will enable caregivers to chart a pragmatic course based on realistic options, and it puts the person who might be receiving care in the future in the driver's seat, because they are telling you, the caregiver, specifically what they want and what they desire. And it would be up to you then as a caregiver to complete what your loved one is expecting for his or her expected lifespan. Let me just provide you really quickly here some caregiver resources from the Family Caregiver Alliance. They have some fact sheets on different topics, such as caregiving and ambiguous loss, holding a family meeting, depression and caregiving, and taking care of you, self-care for family caregivers. There's Elder Care, the National Association of Area Agencies on Aging, the Alzheimer's Association, the National Alliance on Mental Health and federal support for caregivers, as an example. There are resource guides by state that has been completed by the AARP organization. There is information on Medicare coverage, technology and apps, the Zen Caregiving Project, and Parent to Parent. So some recommended sources are Passages in Caregiving by Gail Sheehy, the Caregiver Help Book, and the Emotional Survival Guide for Caregivers. So let's break those chains of not having the resources that you need to care for your loved one. And how would things be different for you if you were to experience less stress, be more present, found the resources that you needed, could stay more centered, be confident, and create ease and joy and fun in your life? Break the chains and do more, be more, and live more. Again, I'm offering you a self-hypnosis masterclass on March 3rd from 8 to 4 Mountain Standard Time. And the cost for this program in March is $247. It's regularly $497. And I invite you to take this course to help you be more present. It will give you strategies on how to become more, do your own self-hypnosis so that you could be more present with the people in your life and the person that you're caring for. It will also help you learn how to look at your metabolic rate and how to bring that rate up so that you could be functioning at a higher level. And it would just give you the resource, inner resource that you need to be more effective and productive when you're working with your loved one or the person that you care for, whether you're a nurse, a healthcare professional, such as an occupational therapist, physical therapist, speech language pathologist, a doctor, a holistic practitioner, or anyone that works with clients that can best help them improve the care that they're providing to someone else. What I'm also asking you, and we'll provide this link, Calendly link for you with the replay of this masterclass. And I invite you to book a free discovery call with me for 30 minutes so I could get to know you personally and help you with any challenges that you have in your caregiving experience. And these are ways that you can connect with me through the Caregiver Lifeline Academy or my email. I can also have you do a clarity assessment as well with me. So let me just check to see if there are any questions that you may have. There are no questions from the audience at this time. So I would just like to thank you for taking your time out this afternoon to listen to this masterclass on lack of resources and how we can start providing compassionate care with one another. I also invite you to the self-hypnosis masterclass on March 3rd from 8 to 4 Mountain Standard Time. and I will put that link in the comment section of the replay. Thank you again. I look forward to serving you in any way that I can. Thank you.